Hello, my name is Dr. Curtis Thompson with CTA Pathology, and I am a skin pathologist who specializes in biopsies of the scalp for hair loss. So I wanted to share with you just a typical case so you can kind of understand how the pathology side works. So a biopsy is done when you don't entirely know what is going on or you want to confirm a diagnosis. So this is a biopsy from a patient, a young man who has diffuse hair loss. So the clinical suspicion is that he has what's called male pattern hair loss or androgenetic alopecia. And this also occurs in women with diffuse hair loss. So we take the biopsy and we start at the skin surface. And this area right here is absolutely at the top, the skin surface, and it's cut transversely. So we're looking across it. And the sections go deeper and then deeper. And then we go on to even deeper levels through the skin biopsy. So deeper, deeper, deeper. And you can see here, when you get down here, you can start seeing all the components of the hair follicle, and you have a hair shaft, you have the sebaceous or oil glands, and all the components. And this patient has a generous number of hairs. Now, when we get farther down, these are the deepest of the sections, and this is the bottom. You can see right away that not all the hair follicles are the same size. And this is typical of the process of androgenetic alopecia, where you start life with large hair follicles with the hair shaft, the hair you see in here. And then as they cycle or turn over, when you shed a hair, they get smaller and smaller and smaller and smaller. And that's what causes the visible diffuse hair loss. And then you can see up a little higher that, and this is a teaching point for skin pathologists, is in these cases you'll see a lot of these catagen, telogen phase follicles. So this is what they look like when you're shedding a hair. So all our hairs are cycling at different times, and then you shed them. And so in androgenetic alopecia, whether it's a man or a woman, you have increased hair loss. And this is especially true when it's androgen driven, like in young men and even in young women. And then also noted, this patient also has typical finding of yeast here. And you can see this flaky what's called orthokeratosis, and this is like the flake you see in dandruff, and it's associated with this yeast that lives on the scalp. So the point for skin pathologists is that you don't see the caps of parakeratosis when you have seborrheic dermatitis in the scalp, and you just see this orthokeratosis. So this is a good case of male pattern hair loss, androgenetic alopecia, with dandruff or seborrheic dermatitis. I wanted to put a quick plug in for the American Hair Research Society's Alopecia Summit, which is coming up on Saturday and Sunday, December 13th and 14th in New York. And this will have a very nice group of clinical hair loss specialists and pathologists like me talking about the diseases that we see: androgenetic alopecia, alopecia areata, central centrifugal cicatricial alopecia, frontal fibrosing alopecia, lichen planopilaris. So it's a very good opportunity to learn about these diseases, and for clinicians, pathologists, anyone who wants to learn about hair loss. So I hope to see you there. Thank you very much. Have a good day.